Our top story tonight, your health records may be facing a breach of privacy due to a new partnership between Google and a top healthcare provider. KAGS reporter Sunny Sai spoke with faculty and students at A&M's Public Health School about the ethics behind the recent partnership.
Google has been and is paving its way into the healthcare industry. The tech company recently formed a partnership with Ascension, the country's second largest health system, to obtain health information of all patients under Ascension.
Ascension is sharing health information of its patients to Google, and with the objective of creating artificial intelligence and machine learning software tools.
The Wall Street Journal on November 11th claims Ascension has been sharing patient records with Google without consent from the patients.
There was a lot of negative criticism specifically related to consent and the notice or lack thereof.
Professor Schmidt says it's still too early to make an ethical analysis regarding this partnership, but some students in A&M's Public Health Department do not agree with how the project was carried out.
It's a little unethical, and it can probably have issues with damaging the trust that exists between patients and hospital administration and just kind of healthcare in general.
There's a lack of security with that. Your loss of confidentiality between the patient and the doctor, and their medical records being sent out to who knows where.
I really kind of have mixed feelings about it. I think that there's really a lot of great potential as far as data sharing and things like that, where we can really improve healthcare as a whole as a result of getting data out there. However, especially without the patient's consent, I'm really not sure if this is the best way to go about that.
Professor Schmidt says these types of partnerships need to happen to move forward in the health system.
The question is, how are we doing it? And that's where a lot of the questions need to be answered by Google and Ascension. Are there adequate processes in place for transparency to the public? Are there mechanisms placed to hold people accountable when there are abuses of data?
He adds, the goal of the project is not to replace doctors, but to help them get the right information they need to treat patients. In College Station, Sunny Sai, KAGS News.
Thank you, Sunny. Patient records have already been shared between Ascension to Google. They claim it's to develop software tools to aid the health industry.